So should parents not be going back to work this fall if they have unvaccinated kids at home?
Well, look, I think people need to be prudent, even if they're vaccinated, about bringing the infection back into the home. We've seen instances where people who've been vaccinated now have become infected and have transmitted the infection. We still believe that the rate of infection among those who are vaccinated is lower than the unvaccinated population, certainly. And we also believe that you're less likely to transmit the infection if you're vaccinated than if you're unvaccinated. But the real-world evidence out of Israel showed that people who were vaccinated, who became infected, were unlikely to transmit the infection in the community. But where they did transmit the infection was within the household, because obviously you have a lot of close contacts within your home. And the upshot is that people who are vaccinated who become infected probably aren't as contagious and aren't contagious for a long period of time. But even if you're contagious for a narrow window of time, that window of time is likely to coincide with when you're circulating in your home, when you're interacting with your children. So I do think you need to be prudent, even if you're vaccinated, if you're around young kids or other people who might be vulnerable. So don't assume if you have a mild cold and you were vaccinated that it can't be COVID.
Got it. Dr. Gottlieb, we have been looking at Israel. We've been looking at the UK. They've both been ahead of us on the Delta cases and high levels of vaccinations. Why do you think those curves right now are looking so different? And as it relates to the path of the U.S., which one do you point to for what could happen next year?
Well, we don't really know. So the curves you're talking about is the decoupling, I believe, between deaths and hospitalizations and cases, where in the UK you saw a very strong decoupling between cases and deaths and hospitalizations. So there were a lot of infections, but not a lot of hospitalizations. In Israel, there's also a decoupling, certainly when you look at the epidemic they're experiencing right now relative to past surges, but not in the same pronounced way that you saw in the UK. I've seen some updated data from Israel. I believe that cases are coming down now. Hospitalizations will start coming down. I do think the third dose, the booster that they're giving to their older population, is starting to have an impact and is already showing up in their data. But one theory on why you see a greater decoupling in the UK versus Israel is the spacing of the vaccines. The UK made a decision based on a need to extend the supply of their vaccines, not based on any consideration about the immunity that it was conferring, but they made a decision to space apart the first and the second dose more. In Israel, they administered the vaccines on the same schedule as the U.S., 3 weeks apart for the Pfizer vaccine, 4 weeks for the Moderna vaccine. And there are some people who believe that if you space the vaccines, the initial 2 doses apart more, you're more likely to get a more durable response from the vaccine. So to the extent that we're seeing declining vaccine effectiveness over time, if you spaced apart the initial 2 doses by a greater length of time, you might have extended the durability. Now, we dosed the vaccines the way we did for a good reason. We were in the middle of a raging epidemic, and we wanted to get as much immunity to the population as quickly as possible. But one consequence of that may be that we have the declining immunity that we're experiencing right now.
To what extent do you think, Dr. Gottlieb, that the U.S. should be considering mandating vaccines on a political level? Do you think this is still just something that's going to have to be done by private companies, by schools, by individuals to sort of suggest that they only want to be around vaccinated people? Or are we overreacting as a whole? Is 50% vaccination level actually quite impressive?
Yeah, I think the Biden administration has actually leaned forward on this, implementing mandates in federal venues where they can. They're mandating vaccines among the military. They're effectively mandating vaccines among federal workers. They're using their tools of reimbursement over the Medicare program to effectively mandate vaccines in a nursing home setting. So I think where they have the opportunities to try to incentivize or even compel vaccination, they're taking advantage of those opportunities. I think mandating vaccines at a federal level would be very tricky. Historically, issues of medical practice have been left to the states. The federal government has not regulated the practice of medicine. The federal government makes recommendations to the states. The states are free to interpret those recommendations and then give guidance back down to local officials. And that's how medical practice has historically been regulated. So I think the prudent thing to do is to allow these decisions to be made by states and more likely by private businesses and local governments. I don't think the state government should be tying the hands of local officials and businesses that want to mandate vaccination. And you have seen in some states governors step in to take away that discretion. I don't think they should be doing that.
Well, while we're talking about public policy, what about what we've seen from New York and L.A.? You have to show proof of vaccination at restaurants, fitness centers. But you don't at hair salons, at pharmacies, at grocery stores, at crowded office buildings. Do these guidelines make sense to you? Or are they based on science, or are they somewhat arbitrary?
I think in some respects they're based on science. In some respects they're based on the practicality of what you can and can't do when you're trying to implement these kinds of provisions. You know, cities like New York and L.A., for that matter as well, face a different set of circumstances and risks because of the density of the city, because of the travel in and out of the city, a greater proportion of people coming in and out, people traveling from abroad. So I think you're going to see cities that face different kinds of risks take different kinds of measures. I'm not surprised to see New York leaning forward and being, you know, on the sort of restrictive end of the spectrum in terms of what they're willing to do, what they're willing to mandate relative to other local governments. And this, again, is a reason why these decisions should be left to local officials. Different local regions, different local governments, different cities face different kinds of risk and also different tolerances among their population. People in the tri-state region are more willing to embrace these kinds of measures because they want to be in a safer environment versus people in other parts of the country who are more likely or more willing to take some risk around COVID.